If you are here, you may have fibromyalgia or know someone who does. My goal is to shed light on this complex illness. I'm not a medical doctor, I'm a psychologist, so I look at fibromyalgia through that lens. This is your place, Fibro and You. I've been diagnosed with fibromyalgia since 2008. I was also diagnosed with neurocardiogenic syncope at about the same time. I've had IBS for many years prior to this, but didn't get an official diagnosis until about 2015. I have hip bursitis and plantar fasciitis, both after fibromyalgia, and both appear to be chronic problems. I have GERD and allergies. I've experienced so many symptoms, and I'm sure you must experience many of these too. There's a lot of confusion about fibro and what it is. You know, it's a confusing list of symptoms that on their own seem ambiguous, but together make up what we know as fibromyalgia. It's called a syndrome because that means a group of symptoms which consistently occur together that make up that disorder. But in my world, it feels like a disease, like other diseases. But more on that in another video. Patients experience issues with noisy environments, bright lights, and particular smells, which can trigger a flare. And since moving too much or not moving enough can cause a flare, patients become confused as to what to do. And that lack of understanding can cause emotions and thoughts that might be misunderstood by family and friends. But I'll talk more about that in the future. For now, we need to understand that it's okay for now. It's a process to better understand your fibromyalgia experience. Maybe because it's not a one-size-fits-all. One patient may be able to sit for longer periods of time or stand for longer periods of time than other patients. You have to find what works for you. Now, does that mean you should sit all day because standing is troubling for you? Of course not. But on our path to becoming more independent and autonomous, we have to process what we are feeling and what is happening in our body in the moment. Because ignoring our symptoms can cause more trouble in the long term. For most of us, the joint and muscle stiffness with tenderness is troublesome. For this reason, it is important to not spend too much time being sedentary. If you're like me, if you sit too long, you're stiff and have trouble moving. But once you get going, it's easier. Then, if you do too much, now you have another problem, severe pain. Therefore, low-impact exercise is often suggested by our physicians. For me, I use housework as my exercise program, and I have an elliptical that I'm able to sit while very light exercising. I keep moving and doing what needs to be done around my house with moderation. Breaks are important to not overdo it. I often sit in between household chores because I need to rest my body to get ready for the next step in the house cleaning process. For me, walking may be difficult when my plantar fasciitis is active, since every step is painful. We need a clear explanation of what fibromyalgia is and what it isn't. Our physicians must help us with this. What is the planned treatment strategy? What is the expected outcome for the treatment? Less anxiety can be experienced when we know what to expect. Our cognitive dysfunction, or what we call brain fog, or cloudy thinking, has been found in about 50 to 82% of individuals with fibro. It may be difficult to concentrate and forget things easily. We may experience poor verbal cognitions at times and forget words. Simple cognitive tasks can be frustrating. We may also speak slower or have altered speech patterns at times. Those who suffer with depression or anxiety will notice an influence on their cognitive factors. However, our information processing is not altered, and works at the same speed as those without fibro. So that's good news. But we also have overlapping conditions. These are unique to each individual. They might include irritable bowel, restless legs, plantar fasciitis, ADHD, GERD, temporomandibular joint disorder, rheumatoid arthritis, osteoarthritis, or lupus. So you can see why the term syndrome was used. Some may be diagnosed with sleep apnea and others have chronic insomnia. And others may wake up multiple times in the night or have a restless sleep. About 50% of those with fibro have a diagnosis of obstructive sleep apnea. In addition, abnormal alpha waves have been found in non-rapid eye movement sleep studies, explaining our sleep issues. Fibro has all aspects of the biopsychosocial concept as well. The main biological aspect of fibro are the widespread chronic pain, fatigue, sleep disorders, muscle and joint stiffness, cognitive dysfunction, and headache that are due to the genetic disposition and a neurological sensitization. We experience allodynia and hyperalgesia. What is that? Well, allodynia is an extreme sensitivity to touch, and things that doesn't normally cause pain can be very painful. For me, it's cold temperatures, wearing jewelry, changing weather conditions. Hyperalgesia is an abnormal, painful response to a normally painful experience that feels more painful than it would have normally, such as a headache, neck pain, or back pain. In my case, the neck and shoulder pain, as well as my hip bursitis and plantar fasciitis, are very painful to me. These symptoms have been proven through objective neuroimaging tests. Neurological aspects relate to our stress and fear of doing something that might create more pain and might cause us anxiety or another psychological issue. With anxiety, the levels of glutamate and glutamine in the brain are increased, which can also cause cognitive issues. But just because someone experiences a psychological issue doesn't mean that fibro is psychological. I'll go more into this in another video. The social aspects of fibro concerns how we relate to others. Do we show empathy or anger? All of these are important in managing our symptoms. In one study, 18% of individuals with fibro have full-blown PTSD, while another 34% have partial PTSD, meaning they had statistically significant lower scores than those without PTSD. Depressive symptoms were shown in almost 82% of those with fibro, while 70% had significant levels of anxiety, and almost 69% had both. But it's believed that these symptoms are often brought on after a fibromyalgia diagnosis, so don't fear. We often experience post-exertional fatigue or a lack of energy, especially after exercise. But exercise can be from doing a lot of household activities, yard work, I'm guilty of, gardening, or anything that requires a lot of energy. So it can be really frustrating for family who don't understand why you were fine one day, and for 2 days after that, you barely can move from room to room. This can relate to the social aspects of our disease. And many of us, prior to fibro, we were very active. So even friends have trouble understanding when we are unable to keep an outing appointment we had planned with them. Yes, I believe we have to be patient with family and friends because they can't see our symptoms. I hope you don't struggle with family. who don't want to understand what is happening to you. We need emotional support. That's for another video. The stigmatization we may feel is real. It's no wonder we work so hard to try to hide our symptoms, because even weather affects our symptoms. So we may avoid activities in cold weather, hot, humid weather, stormy weather. Yikes, that doesn't leave much room for getting things done in good weather. But as I said, we keep moving and doing when we can. And it is the uncertainty of what may come that can sometimes cause some fibro sufferers anxiety. Some researchers consider fibro to be a central sensitivity disorder. Basically, some studies have concluded that there is a neuroendocrine system dysfunction, where the hormones that regulate the body aren't working properly. An autonomic system dysfunction, which includes like our blood vessels, our stomach, our heart, and other internal organs. And all of this is mediated by our central nervous system, our brain and spinal cord. The central nervous system regulates most functions of the body and mind. It's believed that the peripheral neuronal input in the muscles, the messages to the body from the brain, induces neuroplastic changes in the central nervous system. Now remember, our body is made up of two parts in the nervous system, the central nervous system and the peripheral nervous system. And guess what? Both are affected. Guys, if you are wondering if fibro is real, well, it is. It's not a figment of our imagination. So many studies have proven its existence. Other conditions besides fibro that fall under the central sensitivity syndrome classification are chronic fatigue, irritable bowel, chronic pelvic pain, and temporomandibular joint disorder, or TMJ, and migraines. These are all found in some individuals with fibromyalgia, and there are many factors that are believed to activate the central sensitivity syndromes. These might include genetics. Did you know that first-degree relatives of a person with fibro were 8.5 times more likely to have fibromyalgia than first-degree relatives of people with rheumatoid arthritis? Researchers believe that this may be because there's a specific chromosome region involved in the risk of fibromyalgia. However, environmental factors are thought to also be involved. And low levels of dopamine or dopamine deficiency. And what dopamine is a neurotransmitter that sends signals from the body to the brain and helps us in feeling happy. And it's a neurotransmitter or endocrine abnormality. I'm going to link the symptoms to the symptoms of dopamine deficiency in the description below, because I think I kind of messed that up a little. The environmental factors might include prenatal stress, past trauma, severe continuous sleep deprivation, psychological trauma or stress, infection, autonomic nervous system dysfunction, inflammatory cytokines. For example, those of us who get a chronic inflammatory condition first, like rheumatoid arthritis. Lastly, I'd like to mention peripheral inflammation. Studies show this is plausible. Peripheral inflammation, there's two of my puppies back there. Peripheral inflammation is a way for our body to protect itself from aging. Chronic metabolic disorders or chronic systemic illness by producing pro-inflammatory cytokines and communicating with the brain that there is an enemy in our system. And the little one likes to torture the older one. Tessa, that's No, 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 no. Lastly, I'd like to mention peripheral inflammation. Studies showed this is possible. Peripheral inflammation is a way for our body to protect itself from aging, chronic metabolic disorders, or chronic systemic illness by producing pro-inflammatory cytokines and communicating with the brain that there is an enemy in our system. Cytokines are small proteins in the body that are important to help defeat inflammation, but may also slow down the immune system. Yeah, that's a lot. And I'll try to break this down better in another video. In fibro, these are found in very small numbers. Researchers have discovered a pain matrix through advanced neuroimaging that are found in many locations in the brain. What does this mean? It could explain why we hurt. The activated pain-related nervous system characterizes fibro as dependent on numerous neural networks involving neurotransmitters, hormones, neuropeptides, cytokines, chemokines, and a variety of other molecules. These neural processes are integrated across our brain, spinal cord, and the peripheral tissues, and includes the process of neurogenic inflammation. The big problem for researchers is that the pain matrix is located in the brain. It's not like researchers can study the brain by going in and dissecting it. Instead, they must rely on advanced neuroimaging to better understand what is occurring in the brain. It is strongly believed that neuroinflammation or inflammation in the brain is the root of our problem. Perhaps someday, neuroimaging will hold the key. I put a link to an article that explains this better than I can. Most importantly, how does your pain interfere with your daily activities, relationships, social interactions, and your quality of life? Send me an email or share below. I hope you found this lecture helpful, and please like, share, and subscribe so we can get the word out. And I have so much more to come. I send tender hugs and blessings your way. Love you. That's the puppy toy down there. My little puppy is playing. This is a little stinker that decided to turn on his little toy that plays music. Aren't you, baby? Yeah. Say I'm a good boy. Yeah.